So happy to be here. And I saw the talks this morning, and it's been a year of a little over a year of work with the ADAPT team and HIDA. And I have to say, it's been one of the biggest blessings of my life to really dive deep into how we can translate this work into skills and on the front lines where all of you are. So, as I've been saying around the country, I already can see that the HIDA teams and all of those they work with are incredibly powerful resource that I actually didn't know about until about this time last year. And I think you're in a unique position to stimulate systems change, model this innovative way of being that if we think about it isn't so innovative, but it is what our prior speaker said. What we have to take seriously is developing our inner and relational capacities that we are built for, that we are born with, but need to be cultivated through the intentions that we make in our lives. And that's an opportunity that we all have right today. So, celebrating you from the start, and also the HIDA and ADAPT team in particular for including me in this since we started last year. So I want to first start with what are some success signals on where we are with substance use disorder. And the good news is that the trends are a general reduction over the years. However, it is more lethal and there are more deaths. Where we're at around now, this is actually the most recent data we can get a hold of, is about 1 in 4 youth experiencing 18 to 25 experiencing substance use disorder, and a little bit more if they have major depressive episodes. And there's a lot of co-occurrence, as all of you know. And in fact, there's co-occurrence with physical health. There are almost no kids or youth who have substance use disorder. There are only youth that have substance use disorder, mental health, learning disability, all kinds of things. So we're talking about whole children in whole context. And I think if we're going to make more of a difference, we're going to have to go toward that whole youth approach. We'll talk about that. So I've taken a deep dive, and I keep myself as up to date as I can on the evidence. And for a long time, we've understood universal prevention, population-based approaches, early intervention, harm reduction, and treatment all need to be in place. The universal prevention pieces have been a bit more elusive, and the data actually doesn't show a lot of impact by just educating people about risks or harms and things like that. And even skills training for youth outside of the context of addressing their relationships with their family and in their school have shown mixed findings. So we really need to rethink primary prevention, which we're doing, and many of you are doing, through this lens of fostering positive norms, positive mental health, and with an attention to the North Star of early and lifelong flourishing as the core, which can occur with and without problems. And so we'll talk more about that. So just taking a real good look gives us pause. And the exciting thing is that we're, I think, pretty much on the same page about needing to evolve our strategies. So, one major milestone that's been reached, which was not true when I started my work because we didn't measure ACEs in children and youth and families. We had it for some adults, but not that. It was a 20-year journey of getting the data, the measures, validated. And now pretty much everyone knows about adverse childhood experiences, which are really things that disrupt the safety, stability, and nurturance of the relationships in the home, which is the primary protective factor and requirement for healthy development. So trauma can result when ACEs are on board, and they're very prevalent, but we can mitigate through a number of relational strategies in particular. So a lot of what we call diagnoses and label things, and even the cross-cutting issues that lead to substance use disorder, are very related to the impacts of trauma and adverse childhood experiences when they are unmitigated. So that's a huge milestone that we're there. That was not true even 10 years ago. The other is a growing understanding of the primacy of belonging. So when we think about Maslow's hierarchy of needs, we've often put things like love and belonging at the higher end, but really they're in the center, and they actually impact our biology, our brain development. And the good news again is it's within our reach. So love needs to be operationalized. We're built for it. We know it. and we actually can put some intentionality to it. Just like we study DNA and go through all of it in detail, we need to do that with our own capacities to really be the medicine for each other, right? Another major milestone reached is an understanding of the ecosystem that really promotes well-being and health in children and the adults that children become like us. So there's a more widespread understanding. When I was born, there was a belief in biological determinism, and that was that. You were born and that you were stuck with it. But now we know the social and physical environment actually is triggering in an epigenetic flow in many other ways our biology and our brain development and all of the things that help us be healthy. So that's something we can we co-create as a society. So we can dive in and look at that, and that's what we're doing. So that to me is a huge success as well, this eco-biodevelopmental framework and understanding how health happens. We did some research that took about 20 years to get all the data in the same place to be able to look at social determinants of health, where we've made huge progress in understanding, of course, the importance of food and housing and being able to get basic needs met or even all your needs met. And then relational health risks, which are more the ACEs and other factors that disrupt safe, stable, nurturing relationships. So we weren't really in a place to assess all of those until all the variables were in one place in the National Survey of Children's Health, which I work closely with at the same time. So this is just a slide showing you that the prevalence of mental, emotional, behavioral health problems, including SUD, based on a child's exposure to social health risks like economic hardship and housing instability and unsafe neighborhoods, experiences of discrimination due to race or gender identity or even disability. Those are in the social determinants buckets, things that happen in community and in our lives and also meet our basic physical needs and so on. And then relational health risks are more about safe, stable, nurturing relationships. So what you can see here is that those with zero of those social risks are still 2.5 times more likely to have a mental, emotional, behavioral problem if they have the relational health risks. Two or more of those, like two or more ACEs, and that's a large number of people or parents who struggle with mental health and struggle to cope. So it goes up to 61% with also adding in two or more of those social risks. And there's a lot of neighborhoods that meet that criteria. So what we're seeing is a lot of variation, up to fourfold difference based on the social and relational risks that children and youth are exposed to. And again, that's something we can do something about, especially the relational risks, which are closer to our reach. And I wonder if by doing that, we might create a society that can start to support the policies that can actually address the social determinants more effectively. And interestingly and importantly, is healthcare is often where youth go at the end of the day when the problems arise. But 70% of the children walking in with a mental, emotional, behavioral problem, who also typically have also another chronic physical problem in many ways, or I can give you the data on that, but not totally today, 70% also have these social relational risks. So we can't really address the problems unless we deal with the whole child and the whole community. So our whole child risk index sort of looks at, well, what proportion of youth age 12 to 17 in this case have at least one more of these complex health, social, relational risks. So the bar is high here, two or more health issues, social risk, relational risk. They're high bar, meaning they're very evidence-based, and our scoring was pretty conservative. It's over 71% of youth 12 to 17. So it's really all of us across every income group. And the co-occurring risks that I just explained to you call for a whole systems and whole youth approach. So that's really important to know. So my question, after having worked a lot with just bringing to the fore in my own way the reality of ACE and the data we had for adults, translating that for more data with kids and youth to see how it's affecting early development at a population basis, was what are the solutions? What can we actually do to get off the ACE pyramid? So one of the first findings is that more likely is not most. So, yes, most youth with high adversity and these risks do not are more likely to experience SUD, but most do not. So, what is that about? And many without risks or SUD still do not flourish. So, what is flourishing versus absence of disease? We're going to talk about that. So my question from the start was what I call looking at positive deviance. I don't quite like it that way. Positive deviance sounds like a mixed word. But my question from the start is what explains why most with high ACEs and other risks do not experience issues like substance use? And this is most recent data published in 2025 using the Youth Risk Behavior Survey that youth without any of those adverse experiences 93.5 do not use alcohol, and almost none use the opioids and prescription medications. However, those with four or more, 62% no alcohol and 89.4% no prescription drug abuse. However, that's still most. So we still have the question of what is it that is making up the difference for no prescription drug use, which we're focusing on a lot in the country right now, but also even alcohol use, which is most. So what's going on? And we understand this is about pain and addiction. So a key finding next that was really important to establish was that flourishing amid all these adversities and risks is actually common, but it's dependent on healthy child caregiver attachment, and healthy development must always be a priority. And it's also something that we can impact through Winnie Door teachers and all the trusted adults and youth's lives. So I'm going to talk to you a little bit more about this because I frame it as a paradigm shift, a power move to reset our North Star from removing the bad to creating the good. We have to really start where we want to end up, or we start to get the illusion that we're creating well being if we reduce the problem. And that's actually not usually the case. So, flipping the narrative to proactively promote the positive, even in the midst of what's difficult, is not the same as the presence of well-being and flourishing. And let's talk a little more about that. So for adults, we've had a lot of more work done on what makes up flourishing. And a lot more research that shows these qualities, and you can reflect on your own selves. And if we had more time, we'd do a poll and talk about it with each other. Is a sense of meaning and purpose, a proactive sense of wanting to be engaged in life, having and seeking positive relationships, orienting to seek and experience positive emotions and looking for strengths and possibilities as a habit, a sense of contribution, no matter what it is, we all matter, knowing that, and also sense of self-worth, which is not just mattering to others, but mattering just because, which is really the hardest part, is just because, not just because I do something for you. And when we look at adults in our society, the majority don't meet these qualities, but you could consider, are they learned? Can we learn them? Can we create environments that foster them? I think of it a little bit like the weather, that some days it's cloudy and the resilience goes up and down. It's not a state, it's a trait, and it's something we can have more of some days and less of some days. We just stay at the watch of it, kind of like flossing your teeth. We have to floss our brains. And what we found is that this is not my research, but somebody else, Corey Keyes, who really launched a lot of this research, is that death increases as much as 62% over 10 years for adults who are not flourishing at all similar levels of health problems. So lots of health diagnoses, lots of problems, but can we flourish? It's sort of a cruel and unfair thing, maybe, to say that we can foster these things with even when we don't take away the bad. But what are we going to do? And if we do that, maybe then we can start to create the context in the society that cares for one another in ways that we can really shift some of those risks again. So the research on resilience, flourishing, and the relationships as the core adaptive system has been around for a long time. The science of resilience started in World War II when there was a noticing that children did differently, even though they were exposed to similar horrifying experiences. So the studies began then. This book, Ordinary Magic, is one of my favorite, that really delineates what those are. The first is relationships, safe, stable, nurturing relationships, and all of those. The other is to build skills in children and youth where they become self-aware of their feelings, their sensations, the meanings they're making, how to self-soothe, but that's not disconnected from relationships. That occurs through relationship. Beliefs that life has meaning, that they're setting goals, and a sense of spirituality and faith in life, however that happens, is a key protective factor. And then, of course, community and the environment, having needs met, pro-social culture that fosters positive norms, that holds up that most of us can and do. So let's help really foster and celebrate what is working and not just what's not. So we've been talking about all this, but the research is very deep, and translating that though into a population-based epidemiological study was a bit of a journey. So first of all, youth flourishing was not measured. And we have a national survey where it's about $250,000 for every survey item. So everything that I've developed and validated for that purpose so that we can see at a population level and then influence policymakers who need to see the data at their state for all kids, not just a sample somewhere. They really need that. And that's what's sparked a lot of focus on ACEs, is that kind of data and research, as well as now on flourishing. So we had to create this through many years of work, starting from a long list of attributes that could be considered relevant for youth flourishing, and landed on three key things. They actually relate to different parts of the brain and the development. Being able to persist when you start a task that you actually want to do, being able to do that without collapsing quickly or getting angry if it doesn't work out, that we're learning, being able to learn and persist and enjoy the process of learning, staying calm and in control when faced with normal daily challenges, which occur every day. Some days that's better than others, but really getting a strong sense of resilience, which is relationally dependent, as I said before, and then also showing interest and curiosity in learning new things. It's not a personality variation for some people to be more interested and not. You can see it usually in youth. It shows up differently with different emotions, but are youth interested, curious, and interested in learning, which is a natural human trait. And so when we look at this, what we found in the United States for youth 12 to 17, and we have the data for all the ages and all the states and everything, is that about 70% are not meeting all three of these flourishing criteria, actually meeting only 0 to 1. And this is on a survey that has a positivity bias. In other words, this is parent reported. That's why the items are things you can observe. We tested them carefully, that basically, if there's any way parents can say something positive, they do. That's the nature of the bias. So this was alarming, and of course, we didn't know it. And so about 15% meet all three criteria at the always level, which is consistently. And the reason I focus on that, you might say, well, they don't have to always show self-regulation, is the next slide, which basically over and over again, when we look at these three qualities, which are flags for a much bigger concept called flourishing, we find that the consist doesn't always mean always. It means consistently when we respond to that. And see the variation. The orange line is usually, and you would usually is closer to sometimes or never when we respond to it. So, and I've done lots of hundreds of cognitive interviews where I say, well, you said usually, what did you mean by that? Why didn't you say always? And the stories come and come and come. So how can we get the consistency in these factors is really about all of us here today. And this is just an example of 72% being engaged in school when they have the capacity to stay calm and in control when faced with a daily challenge. That includes reaching out for help, being able to say, I feel upset. You know, it doesn't mean holding it all in and just dealing with it. It means resilience is not about that. It's about reaching, being able to say, I need help. And all of those things are key parts of resilience. So you can see the difference. So given the research about relationships, the next challenge was to look at how is child flourishing, school readiness, and engagement impacted by family resilience and connection, which is the positive, not the adverse childhood experiences. So we had to measure that. Now, measuring that was another big journey, but we did get an index, and we know how much pressure parents are under. We also know that even in the womb, maternal stress affects fetal brain development from the start. So our biology, our own resilience, our own capacities to care for one another so that we can in turn care for our youth and children is a critical thing, because attachment, and which is, as you know, may not know a lot about, we could talk about that more later, but healthy attachment requires a felt sense of presence, a felt sense that I am here with you. I see you. You matter, like our prior speaker was saying. And that felt sense is something we can feel. We know it when it's there, sort of like love. We can keep it even in difficulties, which we must, because difficulties seem to be a very common part of life. So, parent child attachment, similar processes going on with you and your own relationships with children and youth, are biological imperatives to be able to optimize our openness to learn, to change, and to grow. And it's a literal felt lived thing that can be assessed through all kinds of fMRIs when it's happening. And we know it starts from pregnancy on and before. So we did validate another measure on family resilience and connection, looking at whether families stayed hopeful, saw strengths they could draw on, reached out for help when things were hard, stayed connected, talked, and worked together to solve problems, parent-child emotional connection, and parents feeling that they're coping and not having extreme stress around parenting. So the bottom line here was that flourishing was dramatically impacted by family resilience and connection after controlling for all the social determinants, all the other health issues that they have, diagnoses, and a number of other factors. So we didn't know that either. And it's about 57.6% without any ACEs experiencing flourishing, if they have 4 to 6 of those family resilience and connection indicators. Now, 57 isn't all, so there's a lot else going on, right? That's the rest of the community and also the deeper work we're talking about today. But without those, with 4 ACEs and without family resilience and connection, only about 12% were flourishing. So the differences are dramatic, and our finding was only about half of youth, school age youth, lived in families that, on their own strength-based reports, experienced these qualities of resilience and connection. And so we know that's an issue, but it's also an opportunity that we have. Right now, a little bit updated data is about half, little over half of families report that they feel they have strengths to even draw on during difficult times. And a similar, almost identical number feel that they are able to stay hopeful when things are hard. Now we'll find out what's going on now. We're getting new data every year, but right now this is most recent. You can go to the data resource center that we lead to get your data for your state, and maybe we can talk more about that at some point, but I wanted to just show you something more up to date. So that leads me to another key finding, which is, okay, the family is really important. We can't always reach the family. That's a big deal. But promoting youth flourishing is actually within everyone's reach, that you matter more than you think. This is a book that I participated in, mostly just wrote the forward because they were looking at the thriving world and caring about the world socially. And we collaborated to basically say it starts with our own flourishing in order to foster a world that cares about itself. So we all matter more than we think, and every moment matters as well, because my body and brain is responsive to the actual lived experience in the moment. If we look back and reflect back on stress, yeah, that's good for growth and self-awareness. But if you're going to impact and undercut the negative impact of stress on your body, you got to catch it when it's happening, because that's when the body and the cells and all the chemicals are moving, and our identity is being formed. So I always say it's your being, their well-being. So your being is critical to being able to foster all of these positive, flourishing qualities with youth, especially those who are struggling, which is the majority in some way. And that's been true my whole life. So I'm not sure if we got any other choice. So one of the pieces of research we did alongside the family resilience and connection was creating a positive childhood experience index. We tried, we didn't know if we could do it, but we had a lot of different items being put on a behavior risk factor survey, and we analyzed those to look at the 7 that really ended up flagging for being valid for being associated with outcomes. And they were all relational, and they were all positive relational. And there was also a paradox because they were about how do we meet each other when things are hard, ends up being how people describe the positive. And I think our prior speaker said that. When I ask people, what's the most positive experience you can remember? I get things like, well, when I was in the ER, I was in the ER and a nurse looked at me like I mattered, or I was really upset and thinking life wasn't worth it. And I walked into a 7-Eleven and the person really looked at me and asked me how I was and to hang in there. So it really is those micro moments that are the most powerful, but it's about feeling able to talk about things, feeling. So that's the other distinction. It's not about if a helicopter came in and said, oh, you have all those positive experiences, yours should be fine. It's did you experience it? And so, did you actually experience it in your body? That's what counts. And so that's why we have to be related and sense into each other, because it's not enough to put a protective factor on the docket. It's only if it's experienced, if I feel safe, if I feel that I matter, if I feel I can impact my life and I have agency, all the core beliefs we'll be talking about more today. So, but you'll notice that not all kids and youth are going to have the family experiences. Can't always do that. But what I know, and it was true for my childhood, is that it was the school and the community and my church that really, really made the difference, and my friends. So I did grow up with most of those ACEs, and there wasn't anything anyone could do at that time in particular. Schools didn't get involved, but I did have the bus driver or the person in the cafeteria who helped me make sure I got food and things like that that made a difference. And so that to me is the powerhouse we all have. And that's really important to remember that it's all of us. And the science base on the impact of teacher care, a felt sense of care, often through presence and listening and responding, does lead to improved resilience, learning, and health, even for children who have all kinds of risks. So there's many research studies on this, and even reading, math, working memory, self-regulation, all of these executive function skills that we need to thrive, or we mostly need to thrive, you don't always need all of them, really come through relational healing. So I always say relational wounding requires relational healing. And that's the opening for being able to then move from there to even learn these skills that we're trying to teach youth. And Laura will be talking more about that, as well as Brian and Patty and Judy later. So it's important to own our power and work through how we can apply it. So all adults matter. We did another study on just listening to children, which is defined by the World Health Organization as a right of children. And it's about listening is two things. We wanted to see if both mattered. Being able to be talking to youth about, asking youth about what they feel, think, just asking. But the other is responding. And responding doesn't necessarily mean an action. It's a sense that you were considered, feeling considered. And asking and considering had to go together to get the hit. And what we found, and this was on quality of life, was looking at all the elements of quality of life for children and youth. This was school age. Looking at their experiences of being heard, which was being asked and considered, and the impact on their quality of life. So, being often heard by both family and teachers was about half of our sample, and they had the highest quality, where they were most likely to have a higher quality of life. Being heard only by teachers, which was only about 11%, it was 40%, and being heard only by their family was about 45%. So we all really matter through any door to be that force for our children and youth, and also for each other and ourselves. When heard by neither the family nor teachers, which is about 1 in 4 school-age children, only 14% had a above average quality of life. So here we are with the next key finding that is I've been leading up to, which is to turn on what I call the resilience switch, the ability to open to the capacity to learn skills, to be reflective, to start to unwind trauma if it's there. We have to go from fixing to connecting, but we get rewarded to do the thing, to check the box. And that's really not our fault, but that's why it's a big systems change. That attuned connection, that felt sense that you can feel in yourself, but it's also learned if we don't have it. We have to keep practicing it. There's ways to practice that capacity is critical to realize the impacts of our existing evidence-based strategies. We have a lot of evidence-based strategies, and when you analyze them, this is what really is the key. So a gut check I'm curious about for you is, do you buy this? Do you feel it's true? And if not, where are you at? What are you thinking? What are the voices of judgment, criticism, or doubt? What are the voices of hope and agency that might be arising for you? And maybe this is all not new and you're already there and celebrate, and you have to join us and help everybody else. But your work, no matter how small or large, has the chance to revitalize the fabric of safeness and belonging for youth using your own being. Fostering your own flourishing, therefore, is essential. And when I do this assessment of adult flourishing, it's not very high for many people, but everyone's stronger and stronger in some area than someone else. So in our teams, we can really help each other. And the bar is high, so we need to. Helping youth really means activating their own sense of mattering, hope, their will to heal. I always say activating the will to be well. I don't always see that in the youth that I've worked with. They've lost hope, or they don't believe they can, or that it matters. It's their own self-awareness, meaning they understand that their experience has something to do with how they're thinking and their beliefs, and doing that in a way that creates a sense of agency and self-love is very, very important. And then those skills can start to be learned once we open up a sense of mattering, hope, and the will to heal and self-awareness. But when we just try to teach and educate, like I showed in the beginning, practical things and so on, it's not necessarily leading to the outcomes we want. So we have to really be that presence. And you can't, I think this was said before, you can't just shake somebody and say, you matter, you matter. We can't do that. But there's a lot of research on how mattering is the piece that is connecting trauma to a lack of willingness or seeking help. So when we think about this, we really do have to continue to focus on developing that sense of mattering and hope in order to then teach the skills and have that turn out. So there's lots here. And I always talk about rewiring our vicious cycles. So I have it, you have it, we all have it. Being aware of what our beliefs are and how that actually is connected to patterns of thoughts, habits of perception of what happens. And then we have emotions, which drive our behavior, then get a response from the outside that often can confirm the negative, say you have a negative belief that I'm alone, and there you interpret what happens. You think you're alone and people don't like you, let's say. That's it. And your perceptions will screen for that and validate the emotions and the sadness, which can lead to withdrawing, which can give people the signal that you don't want to be a part of something, so you don't get invited, and it confirms. And so this is happening all the time. But to understand that we actually can become aware of our thoughts, perceptions, emotions, you can't just go in and say, believe this thing. That emerges through the process of unwinding, which is a lot of what we're trying to do. There's a huge amount of studies on what is a healing relationship. And the health promoting relationships paradigm Laura's going to share more about is much prettier, but there are studies that have looked at what is it that helps people heal from trauma, to develop a sense of hope, trust, and being known. These are the relational outcomes that we want to look for. And there's also clinical competencies, and this was done with providers, healthcare providers, of being confident and being certain that your presence matters, that you can support and help heal. Having your own emotional self-regulation and management, which is something to just keep practicing. It doesn't mean we don't have all kinds of emotions, but being aware of it and intentional, and having knowledge. There's a lot of knowledge. So the processes that happen are in three buckets: valuing, appreciating power, and abiding. And so the health promoting relationships model breaks that down into a lot more competencies, but there are things to just be thinking about: really valuing the youth and being present and connecting and making that first. Appreciating power, that you are somebody that has more knowledge, that has capacity, but also is equal. So you want to partner but also own your leadership to help educate and push. And so we don't want to go the other way where we don't own that agency that we have, but in a way that appreciates the power dynamic and the need for all of us to feel like, even if you're a lot older than me, you see me and I am equal. And then abiding, which is being present and staying with the youth through the issues they have. And that's where the systems change comes in, because you're not going to be with that youth all the time, but somebody will be in your sphere, on your team, in another system. So coming together as systems and teams is critical to manifest what we're talking about. And we have I'm not going to go into all this, but we do have a really robust evidence-based set of strategies for health promotion and healing. And I just put three of them into three buckets. I put about 100 different evidence-based things into three buckets: time in, time with, and time for strategies. These are things we can teach and practice and do with youth. And often it's not it's not possible without that engagement. So the engagement is the key. And one of the things that I find is important in working with youth or myself or others is what I call the positivity paradox type 2. And I've given it the name Finding the Jewel, which is the notion that, and you can check it out, I think you'll find it's true, that underlying all of our stress and the problems and the things we come to each other with that are hard, they're hard because there's something we care about. They're hard because we know there's something that's good and right and true. That belonging, mattering, justice, fairness, contributing, these are all important. We know those are important. And when they're violated or don't look like they're happening, we have a problem and we get emotional around it. So if we can help youth and ourselves remember that our issues and our challenges are problems because we actually know something about what is good and right and true. And that is who we really are. That's what we're sitting on top of, and that's our core. So the last two key points I want to make is, first of all, we have a cross team through any door strategy that's needed. I mentioned that before, where we really share a commitment to not be perfect. It's intention, not perfection, to building relational safety and care through every door. Again, we have over 90 policies. This is from the NASEM report on fostering healthy mental, emotional, and behavioral development in youth. They're at every stage of the life course even, but the common denominator success factor for virtually all of them is relational safety, trust, care, and personalization. Things like, taxes and laws and things like that that block the availability of drugs and alcohol, of course, also are important, and they do have an impact. But when we talk about the strategies, they all require engagement and that trust sense of, I choose you as my trusted adult, like we've been talking about. And that's pretty exciting. Some of the research on a very extensive study done on looking at behavioral health and integrating it with primary care found that youth actually don't engage in the resources that you are offering them if they don't even see you treating each other in your team with care. And so if I walk in and see adults not caring for each other, then I'm not going to trust you, because that's really what the core is. So it's very important that we think about how our relationships are as a team and bringing this work into that level of intimacy, which many organizations do now, like the Sanctuary Institute, which is been around for a long time. They start 5 minutes every day talking about how they're doing and who their support person is going to be, trying to bring in these attributes into the team, knowing that that's going to be a very key factor for whether youth will engage, seek help, feel safe, come back. And we know often youth do not come back when we offer help. Uptake of resources, even if we screen, is very low for parents, for adults, for most people. And I think these are some of the factors involved. So just again, because you'll recognize these evidence-based strategies, life skills training, positive action, the good behavior games, so on, all really do require engagement of youth and families. And that is very much predicted by the relational safety, trust, and so on. So Doing this requires we stay at the watch of our own flourishing. I mentioned that already, and it's probably something you can intuitively understand. But there's research too here about just a sense of you in your team or in your organization having your own sense of belonging to your group. It really improves our feelings of morale, our own hope, our own possibilities so that we can be that presence for youth. So, a sense of belonging to a team, your own sense of belonging, really reduces burnout, even with similar kinds of stress. And many of us are first responders, and we know burnout is huge. How do we source what we're talking about for youth when we're also feeling pretty beleaguered? And it's really the protective effect of a sense of belonging. And there's dozens and dozens of strategies that are offered that don't take a lot of time in teams to foster that we could talk more about. And finally, in this section, before I get to my final point, is that studies actually show that 40 seconds of you being present and holding compassion for a youth or anyone, which often doesn't even involve words, but it's a felt sense, actually improves their health. There's fMRI studies and other things that show the power of that and help regulating their own nervous system so then other things can happen in the body. Because when we get into a lockdown in the body, even down to the mitochondria and the cells, there's something called cell danger response, where the cell doesn't even take in the good that might be circulating around it because there's this, at that level, even a sense of shutdown, fight or flight. So our own compassion, which doesn't mean fixing, it's fixing to connecting, witnessing, holding space, is very powerful. But it also helps regulate your own body and your own well-being. So it's a two-way street. And it's also true with parents and their children. When they're offering this kind of way of being, they're actually regulating their own body and nervous system, improving their own well-being. So there's plenty of research on that, even published in the Journal of Cardiology, on the importance of shifting to presence and appreciation and how that can actually help regulate, say, heart rate variability. So the bottom line for me today as a added concept is that inner work helps external work, and a good amount of the health promoting relationships paradigm focuses on your own competencies and skills that in turn can be helping youth develop their own core beliefs and their own skills and outcomes. So who we are is more important than what we do, in the sense that if we do something outside of this way that we need to be present, what I'm talking about, often it doesn't have the impact, and then we can get discouraged. So really valuing that is important, and your own flourishing. We have to admit and take a pause that the approaches we've used up till now have had diminishing returns in many ways with lots of investment. And if we're going to create a Congress or legislators who want to invest their money, our society's money in this, we need to start showing outcomes. And I think these are some of the factors we're talking about today that will allow that to happen so that we don't get such huge dropout rates for programs we're trying to support youth with, that we really do the work to make them successful and, of course, border it with research. So my conclusion that you may all already agree with is that scaling the possibilities for the research and all of what we're talking about with youth who can flourish even amid adversity requires relational systems of care. We've talked about teams, we've talked about the one-on-one with youth, but relational systems. So youth go to school, they go to healthcare, they go to lots of community-based programs, faith-based groups, all sorts of, they work, they go into businesses, and if they're not seeing some consistency, it can throw them all over the map. So that's one thing, but that requires that we come together and agree to some simple rules about which how systems change is they first adopt a vision and simple rules to guide individual action and group action, because we can't go in and micromanage everyone. We have so many strengths, so many programs, so many things funded, but they usually don't even know about each other. And it's because we haven't created resources to create that interstitial tissue, if you will. So collaboration, certainly across education, healthcare, social services, and community resources, often stall before demonstrating impact. And it looks to me when we do the research, it's because of how they're being done, how the relationships are being handled in those groups. And so often people come feeling very beleaguered and burned out and don't have time to create the relationships that then can actually be the powerhouse for creating change. I remember a story being told when COVID happened that in the Norway and other countries, they didn't need to pass a law because all of the regional health leaders had strong relationships and they just decided to do it on a call to do what they needed to do. And so when you have relationships and trust in at that level, you can act quickly often and get feedback loops. And it doesn't all have to be bureaucratic and regulated, although we do need those policies as well. So, if any of you know James Clear, who talks about how do we change habits? If we've got habits, they're habits, right? We're built for all of this, but we've got some habits. And what we need to keep remembering is we can't just have goals, which we do. I think everyone does have the vision and the hope, but we don't rise to the level of our goals. We fall to the level of our systems. And so it's an interesting thing, maybe as I close here today, to think about, well, what are the strengths and superpowers of your system right now? Let's start with that because they're all there. Consider what mindsets are supportive, knowledge base, capacity, what existing partnerships and relationships are working or could work or are strengths, policies, practices. When I do that list, it's a long list of strengths. But what are the existing challenges and needs in your system? And is any of what we're talking about today relevant to addressing those needs? So, how can we leverage existing strengths and superpowers, what I call superpowers, because I think we're built with them, to address existing challenges and needs? And there's lots and lots of reports for decades, really, that have come up with this idea of we need integrated systems, but the how is the key. And I say that everyone is a leader in the work of systems change, no matter where you are at all. You can be in the business of activating awareness, mindsets, priorities, just awareness, teaching. You could be at the business of creating partnerships, small, large, all matter. You could be at the business of practicing, doing the work and helping be a part of learning about it and keeping the flow going to demonstrate possibilities in the real on the front lines. Or you could be in the work of policy change. We have a whole policy playbook of essential policies that are keeping sectors from working with each other or that block our ability to do what we're talking about. And there's a lot of little policies. So wherever you are in your ecosystem, you have power. And there are also whole paradigms on how do we bring groups of people together in a way that is relationally based, recognizing that we come to our partnerships with our own voices of judgment, cynicism, fear, and pain, and that is also impacting. So this model, Theory U, as an example, is out of MIT with Peter Senge, if any of you know who he is, a learning organization which basically went and created the Presencing Institute for businesses. And Theory U is a model they're using with all kinds of big Fortune 500 companies that recognize that we don't really get sustainable change when we don't recognize what's actually already there. By making present what's absent, which is often all of this existing judgment, cynicism, fear, pain, doubt, our own trauma. Somehow we can do this in a group with lots of skill that doesn't get weird to then be able to quickly act and quickly go right upside the other part of the U and work really quickly together. Like I was saying, the health officials in Norway did. So there are models, and they do focus a lot on this practice of listening, listening not from automatic pilot to confirm what you already know, or just listening to notice differences and maybe just confirm, or listening, but listening starting from within to really see through another person's eyes. That felt sense connection starts to come in at that point. You'll know when you get to level 3 and this level 4 when you feel it in your body. And you will feel it in your body, and you probably already do. Most people here, I'm assuming, understand what I'm talking about. But listening from the whole is another level, which is we need to find new solutions. how can our presence with each other be able to give rise to new ideas and to new ways that allow us to really start to make the difference. So the bottom line is we need what I call one big doable thing, primary prevention into the drinking water of every community. Lots of reports, lots of ideas. This is Pain in the Nation. I worked with them on this report to get in the early childhood piece in particular. Lots of history, Neurons to Neighborhoods from 2000, 2024. We came out with Launching Lifelong Health. There's so many resources. But at the bottom line, it's really you all in the programs that are the most important. I'll just end with saying we are all flourishing facilitators, whether we want to be or not, but it does require that we start to think through the lenses that we're talking about today, a positive construct of health, really anchoring to the science and the evidence, because it's there, and understanding it and building it is critical, and then translating that into possibilities in our relationships with each other and across our systems will create the flourishing ecosystem. And I just want to do a quick time check. Where am I? Do I have 3 more minutes?
We have 1 more minute.
Oh dear. Okay. Well, I guess I will just not go through this, but tell you that I've applied the neuroscience of what we're talking about to policy, where we free our brilliance by aligning our what we know is true with our reward systems and financing, take on transparency by being more curious than afraid to get feedback about how it's going and making that key through measurement, realizing we need to become wing ninjas, that we aren't really doing the job that we need to, but that's okay. We can learn to always prioritize possibilities and not allow ourselves to get out of the mindset of possibilities and strengths so that we can take on trauma, and that all of this is really critical, that we brave being, that we really look at our own well-being and capacities. So that is my talk. And up next is Laura and the team at ADAPT to really unpack a lot of this health promoting relationships paradigm that's evolved over the last year. And I'm very, very grateful for your time. Thank you.
Always such a treat to have you join us. And as I've listened to you speak today, and I reflect on when you first introduced us to relationally learned attributes last year, I see along with you just how far we've come in synthesizing so much of this, and really appreciating the language that you bring forward around what is flourishing, what does it really look like, how can we grow that within us and within others and within our states and our systems. And we don't have time to go through the questions that came in, but I do want you to know that people are thinking about this. They're asking about systems, they're asking systems level questions. What if the system I'm in doesn't necessarily align with what you're suggesting? And I know that you do a lot of work with policies. And so I just want to give you an opportunity, if people would like to learn more about this, beyond the resource supplement, beyond the connection to CAMI, the Child and Adolescent Health Measurement Initiative, what can they do?
Well, I do think that we do have a whole framework called Engagement in Action, which goes into excruciating detail on a lot of the partnership-based model for integrating statewide health systems for children and youth. So that would be one thing. If you just type it in, Engagement in Action, and at CAMI, or go to my website, you'll see that. And that was done with HRSA and the federal government through a congressionally authorized requirement to build a model that could be scaled across states. And so it really is based on all of this thinking. And so that would help. And then I would just say email me, because whatever you want is going to be tailored, and I'm happy to respond. It could be research, it could be practical strategies. So I would just say at this point, email me. But that's one model that is actually specifically designed for the systems level piece.
Okay. Would you like to share your email publicly, and then ADAPT team, if you can capture that and put it in the chat box, please?
Oh, sure, yeah. It's
sure
easy to find me. It's cbethel@jhu.edu. And if you just type in my name, it usually we don't have a lot of privacy, which is fine. So I'm pretty easy to get a hold of. Yeah.
Okay, cbethel@jhu.edu.
Mhm.
Dr. Bethel, thank you so much.
Thank you.
We
I
are
hope we
going
can
to wrap.
do, hope we can do like a 6-day workshop one day. Just go
I
right
know.
into
But we're
it.
big dreamers. We're big dreamers, guys. And there's
Yeah.
a lot of exciting things to come in 2026, and we'll see what the future has in store for us. But I absolutely know our paths will be crossing in many different ways over 2026 as we bring your science forward and translate that. Okay, we're going to wrap up this session, and I can't wait to share a little bit more with you guys about this health promoting relationships paradigm. So I'll see you if you log out of this and log into the building the health promoting relationships paradigm presentation. I'll see you over there. Thanks, everyone.